So good afternoon. My name is Lisa Farnham. I am from Blue Cross and Blue Shield of Massachusetts, but I'm not here to talk about Blue Cross at all. What we're really talking about is planning for Medicare and that countdown to 65. So everyone should have a copy of all of these slides, and I want to thank Kevin and the Tolles-Parsons Center for having me today. This is actually my second presentation here. But Kevin's been super helpful, and I want to just say thank you, and thank you for this opportunity. So let's get started. What I'm going to do is cover a couple slides, and then we'll stop and see if anyone has questions. So our agenda today, we're going to talk about, in section 1, Medicare and Medicare-related options. That's where we're going to spend the bulk of our time today. And then at the end, I just have a couple slides talking about those who retire prior to age 65 and what the options are available to you. So this slide gives you really a landscape of how everything works once you go on to Medicare. So everything begins with original Medicare. There's two parts, Medicare Part A and Medicare Part B. Medicare Part A is premium free. Medicare Part B has a premium. We're going to go into more details on Medicare in just a moment. But Medicare is pretty much an 80%, 20% plan, where Medicare pays 80% of your medical care and you pay 20%. And you could stop and say, that's enough insurance for me if you'd like, but generally people add additional insurance. And they add other insurance to either pick up the 20% that Medicare does not pay for, or they add additional insurance to pick up coverage for things that Medicare doesn't cover at all. So maybe things like routine eye exams, routine hearing, hearing aid coverage, things like that. So there's two different paths. So you're starting at Medicare. You could decide that you want to purchase something called a Medicare supplement plan. The supplement does exactly what it sounds like. It supplements Medicare. It's a secondary insurance to Medicare. You're buying a supplement from a private insurance company. So you're getting Medicare from the federal government, from Social Security, but you're getting all of these plans underneath from private insurance companies. So the Medicare supplement is your secondary insurance after Medicare. So depending on the plan you choose, it will pick up some or all of that 20%. But neither Medicare or the Medicare supplement plans provide you with prescription drug coverage. So if you go down that path and want prescription drug coverage, you'd need to purchase a standalone separate prescription drug plan. Those are also referred to as Medicare Part D, D for drugs. So that path, original Medicare, Medicare supplement, and Medicare prescription drug, 3 different plans, 3 different ID cards, 3 different premiums. Tends to be more expensive from a monthly premium perspective, but it's more predictable. And what I mean by that is, you know your Medicare is paying 80%, and your supplemental plan is picking up all or most of that 20%, leaving you with little to no balance. So there's no balance there. You're not paying co-payments. So you know you're just paying your premiums each month. So that's a way to get insurance coverage once you're Medicare eligible. The other way also starts with Medicare. You could decide to purchase something called a Medicare Advantage plan. These are the plans that you're seeing those ads on television for. Hopefully they've slowed down because open enrollment finished last week. But these are also referred to as Medicare Part C, as in Charlie. They provide you with all of your Medicare Part A and B benefits. They take over for Medicare, and then they add in extras that Medicare doesn't cover, including prescription drug coverage, some routine benefits. So you've seen ads for dental benefits and eyeglasses and things like that. So that's what those Medicare Part C or Medicare Advantage plans pay for. These are HMO plans and PPO plans. So HMO stands for Health Maintenance Organization, and PPO is Preferred Provider Organization. They're managed care plans. You might have had these at work, perhaps. So with an HMO, as an example, you're selecting a primary care doctor, you're staying in a network, and again, we're going to go into more details. But these plans operate really differently than the other side. So with the Medicare Advantage plans, and you've seen this, some of the premiums could be as low as $0. The most popular plans are around $0 to $100 in premium, and you're still paying your Medicare Part B premium. But with these plans, you're paying as you go for care. So if I go to my primary care provider, I maybe have a $10 copayment. If I go to see a dermatologist, maybe I have a $40 copayment. Depends on my plan. But I'm paying a copayment or coinsurance as I go for care. Different than this other side. And again, the premiums are less, but it's not as predictable because you don't know what care you're going to need in advance. So we're going to dive into all of these boxes in more detail. But any questions about this first slide? The other important thing to know is you can always change. So you're never stuck. You can change at least once a year from one side to the other or back and forth, whatever it might be, at least once a year. So you're not stuck with a decision for the rest of your life. Yes? So her question is, do either of these plans have any dental coverage? So some of the Medicare Advantage plans include dental benefits. Yes. So this side includes dental. You have to look at the plans, but the Medicare supplement does not include dental. So if you went down that path and wanted dental benefits, you could buy a separate standalone dental plan. Yeah.
You said the Advantage you also.
Correct. With the Advantage, either way you go, you're still paying your Part B premium, even though the Advantage plans are taking over for Medicare. In that instance, you're still paying that Part B premium. Yes.
Well, it sounds like an obvious answer.
No, ask.
If you can work and continue to get employer-provided health plans, that may be the best bet because then you're not
So his question is, if you are still able to work after 65, and we're going to talk about it, if you're able to work past age 65, is that better or easier or whatever it may be so you don't have to deal with any of this Medicare stuff? So the answer is, I guess, yes and no. So generally, the company plans that you have while you're working are generally more, are better benefits, more generous benefits. And the company pays something towards your premium. So you're not paying your whole premium. But it could be for some people expensive still. So you still could be paying 20% of your premium or whatever it might be. And if you have a family policy, that could be expensive.
But you don't have the option of going into Medicare if you're working and you're...
So his question is, good question. So his question is, if you're still working, do you have the option of going into Medicare? And the answer is actually yes. You could absolutely sign up for Medicare A and B and decline your company's coverage. I'm not recommending that you do that. You kind of want to do the math, but you absolutely can do that during your company's open enrollment if you choose to do that and then go down these paths.
But you can't have the company and the Medicare.
So if you work for, you know what, I'm going to have you hold it because we're going to talk about it in just a minute, if that's okay. Yeah. Yes.
So, would Medicare pros and cons?
So with original, to answer your question, with original Medicare, you are able to see any Medicare contracted provider anywhere in the United States. I don't know the percentage of providers that is, but it's a lot. So let's talk a little bit about Medicare, and then we're going to go into the questions about work and all of that. So on page 5, what is original Medicare? So it's health insurance that you're getting from the federal government. Medicare Part A is your inpatient benefit. So that is, if you're in the hospital overnight, they charge you for things like room and board and tests that are done, medicine, all of that. Everything and anything except for your doctor services are part of your Medicare Part A benefit. Medicare Part A is premium free. because you've worked and paid into the system for most people, so it doesn't cost anything. Medicare Part B is your doctor services and outpatient services. So that could be something like a visit to an emergency room, an ambulance ride, a lab test or x-ray on an outpatient basis. And Medicare Part B does have a premium. It's $174.70 for most people per person per month. If you're already collecting Social Security, they may take that Medicare Part B premium out of your Social Security check. I'm going to have a slide later in the presentation that will show you the way that they arrive at this amount is based on something called your modified adjusted gross income. And so they look at your tax return. They do a 2-year look back. So for some people, if you have a higher income, this Part B premium may be higher. And again, I'll explain that later in the presentation. So the way that Medicare works, you can see any doctor, any hospital, anywhere in the United States, but there is no coverage outside of the United States. Even if it's an emergency or urgent, doesn't matter. So no coverage outside of the United States. In the US, you can see any Medicare contracted provider. So anyone that accepts Medicare. It's not an HMO and not a PPO plan. So it's not a managed care plan. You don't have to get referrals. You don't have to pick a primary care provider. And there are some costs for you. So you may need to pay deductibles in certain instances and coinsurance. So her question is, what are the chances that an MRI or a CAT scan or something like that could be denied? I mean, it needs to be medically necessary and not experimental. But otherwise you need to go to a Medicare contracted provider. So if you don't do that, then it wouldn't be covered, but otherwise it should be.
Would there be delays? Because I hear these.
Delays in getting appointments? Is that what you're asking?
Let's say you're in an ER.
Because you're a okay, got it. So her question is, if you just, make sure I'm saying this right, if you just have Medicare, are you going to get different care, I guess, or different service than somebody that's enrolled in a private? So I would hope not. I mean, I don't know the answer to that, but it shouldn't be that way at all. Hospitals sign a contract to either accept Medicare patients or accept the private insurance, and they should treat everyone, the same. So it should not matter.
And the medication.
So do you mean prescription drugs when you're in the hospital overnight or outpatient? Okay. So prescription drugs when you're in the hospital are part of your Part A benefit, absolutely. So it shouldn't be an issue. And if it's part of your Medicare Advantage plan as well, again, as long as it's not experimental and there's nothing, nothing weird, they should, I don't know why they wouldn't cover it. Outpatient medications at a pharmacy or at a mail order, we're going to talk about a little bit later. Plans, so Medicare does not provide benefits for that at all. The only way you get that is through a private insurance company. And they have something called formularies, which I'll talk about, but that's a list of covered drugs. So if the drugs that you're getting aren't on that list, they're not covered. But we'll talk more about it later. But yeah, your care should not be different. Your benefits, again, Medicare doesn't provide routine coverage. So if it's preventative or things like that, it's different. But if it's for a diagnostic reason that you're getting the medication, you should absolutely have benefits. So there are so many situations and scenarios when people are going to be eligible for Medicare. But in general, people can find themselves in one of three scenarios. So the first is if you're turning 65 and you are already collecting your Social Security benefits. So let's say you started collecting at age 62. Because you already started collecting, Medicare knows about you. So what they're going to do, or Social Security knows about you. So what they're going to do is they're going to automatically send you something in the mail to enroll you in Medicare at age 65. So about 3 months prior to age 65, you're going to get something in the mail offering you Medicare A and B. So if you want it, great, say yes, and you're good to go. That's the easiest of all scenarios because you don't need to do anything. The next scenario is if you're turning 65, but you're not yet collecting your Social Security benefit, but you do want to take Medicare at age 65, let's say you're not getting any insurance through work, here you need to do something. You need to act. So what you need to do, you have what's called an initial election period. It's a 7-month period of time. So 3 months before your 65th birthday, your birthday month, and the 3 months after. So during that time, you can contact Social Security and say, I'd like to enroll in Medicare A and B. And you can do that without any penalty during that 7-month period of time. Yes.
If your wife is working or your spouse is working, you don't need to sign up for Medicare.
That's my next slide. So wait 1 second.
But that's different from like Medicare A, which is you get. Is the other plan, I guess, that deducts money from your social.
So Medicare Part A is premium free, does not cost you anything. You could still, let me get there, okay, because it's the next slide.
All right.
So again, in this instance, you're going to say to Social Security, I want Medicare, I want to enroll. I would recommend doing that 3 months in advance just to make sure you're all set for when you're 65. And as long as you have Medicare A and B, then they will start billing you for your Medicare Part B. And then you can decide if you want the other insurance. So to answer your question, the last scenario, people are living longer, staying healthy longer, and deciding to work past age 65. So there's a couple things here. If you are still actively working, or if you're covered on your spouse's plan and he or she is still actively working, when I say active, I mean working, getting a paycheck, doesn't mean COBRA, doesn't mean a retiree plan. So you're actively working and on their health plan. After age 65, you can continue to stay on that plan as long as you're actively working. You can
Without
both,
Medicare.
without any Medicare. So you do not need to sign up for Medicare Part A or B. If you want to, sometimes folks will sign up for Medicare Part A. That's the one that's premium free. They do that maybe just to get in the system. It would be your secondary insurance to your employer plan if you're working for a larger company. But sometimes people do that, sign up for Part A. It's purely optional.
Okay,
Yes.
so when you do stop,
Okay, so let me get there. So this last bullet here. So let's say I work till I'm 67, and then I decide, bye-bye Blue Cross, I'm leaving, I'm retiring. So what I would do is I'd contact Social Security and I'd say, as of, let's say, I don't know, March 1st, I'm gonna retire. So I wanna enroll in my Medicare A and B. So they're gonna say to me, Lisa, that's nice, but where have you been since age 65? Because I'm 67. And I'm gonna say I've been actively working at my company, and they're gonna give me a form that I'm gonna take to my company. If it's myself and my husband, they're gonna give me 2 forms. So I need to take both of those forms to Blue Cross or to my company, not my insurance plan. Say I worked for Newton Wellesley Hospital, that might be easier. I'm gonna take both of those forms to Newton Wellesley, my employer. They're gonna say, yes, Lisa's had continuous coverage. And then they're gonna enroll me in Medicare Part A and B effective March 1st. So if I did not have any coverage at age 65, I wasn't working, I didn't have Medicare, and later, at a later date, I sign up for Medicare Part A and B, I can get a late enrollment penalty for my Medicare Part B. So they do want you to have coverage at age 65, either through an employer or through Medicare.
would the employer be responsible for sending?
So it depends, her question is, would the employer be responsible for sending those forms? So it depends on the employer. Some employers will send it. I always recommend that you get it back, you make a copy just in case. Medicare or Social Security is a big place. So, and that you mail it in and you have a copy just in case. But at some companies may mail it in, their human resources department may mail it in for you. So does that make sense? So again, when
Cover
you,
it right after you stop working? Or
so her question is, I guess both, when do you start the process and when, so it's up to you. You know with your company, you're gonna, actually, you don't always know. Sometimes it's an involuntary, let's say there's layoffs. So, you know you're gonna be covered through the end of this month, let's say, December 31st. You would contact Medicare and say, I'd like to have my Medicare start on January 1st. If you know you're going to have, you're getting paid through your employer for another month, you could say, I want it February 1st.
But you
Sometimes
have to
they
have
may, pardon me?
You would have to have that coverage though. Medicare A and B. And you work at December 31, come January 1, you want to be on Medicare A.
So technically you have 8 months from when you leave your work.
So you would be.
You
8
have a
months
little,
without
you
insurance?
could without a penalty.
Without a penalty?
I'm not recommending that, but yeah.
Well, if an emergency, you would have no
No coverage, exactly. Yeah, I'd recommend as soon as you know that you're leaving. If you know 6 months in advance, they're not going to talk to you at Social Security. So 3 months is kind of that sweet spot, but you can give them 3 months notice. And your, it depends at your employer what they require. So yep. Good question. To the best of my knowledge, I don't know the answer to that. I was thinking no, but I'm not sure. If they're both after 65, they may ask you to prove that you've had consistent insurance. So you may. I am not 100% sure. It's a Social Security question. They do send you a form. But I don't know if that form is the same form that Social Security asks you to complete. It's something different, I think, for the state. So I just don't want to forget this. If you are working for a smaller company with less than 20 employees, or again, your spouse is working for a smaller company with less than 20 employees, and you're on that plan, they do recommend that you enroll in Medicare at age 65. So you should enroll in both Medicare A and B. And then take your employer plan. So there's a note at the bottom that's really important. So at companies, there are plans that are called high deductible health plans. And it's exactly what it sounds like. It's an insurance plan with a high deductible. Sometimes what companies will do is pair that with something called a health savings account, an HSA. I don't mean to get into details, but if you have a high deductible health plan and a health savings account, this doesn't apply to FSA, flexible savings accounts. It doesn't apply to HRAs, so it's just for HSAs. But there are rules that basically say you can only have the high deductible health plan and the HSA. You can't have any other plan. So Medicare would count as another plan. So the recommendation is that you stop your contributions to, and your HR department knows this, you stop your contributions to your health savings account about 6 months before you're going to retire. So there are not tax implications for you. Again, it's something you want to discuss with your accountant, with your HR person, but it's only applying to health savings accounts. So you just can't have that in Medicare. Yep, so her question is, so if you continue to actively work, so you need to continue to actively work, and you decide to take Medicare Part A. So you'd still be submitting things to your work insurance, and if there was any with your inpatient services, your Medicare Part A benefits, if there was anything left over, sometimes, I can't even think of an instance, but there could be. Maybe you have a plan that's 90%, 10%, I don't know. If there's anything left over, they can submit it to Medicare to cover. Medicare's only going to cover based on their contracted rate. So if your employer plan has already paid that, they're going to look at it like it's paid in full. But you shouldn't have any balances. Does that make sense? So Medicare is going to pay based on their contracted rate. So if that's already been paid, there wouldn't be anything left over.
So if the private
Yeah.
but the
Oh, they should pay so they should pay the deductible piece. But if they've paid whatever the amount is and there's nothing left, or there's some left over, but it exceeds the Medicare allowance, Medicare wouldn't pay anymore, but they should pay your deductible. Yes.
I see.
Yeah.
So can,
So her question is, can your primary insurance balance bill you? So the answer is generally not. It depends on the primary insurance. It depends on where your services are. I mean, there's a lot of there's a lot of ifs and, things like that. So it depends. If you see a contracted provider, they sign a contract with the insurance company to agree to accept whatever the allowed amount is. So they should not bill you for the difference between that allowed amount and what they would regularly charge. Yeah. The top of the screen says 2023, but ignore that because it's 2024. So the next two slides are just going to show you the Medicare benefits if you only have Medicare, if you have no other insurance. So this is how it works. So Medicare Part A, I mentioned, is your inpatient benefits. If you're in the hospital for 1 day or in the hospital for up to 60 days, you are responsible for a deductible of $1,632 that you're paying in the hospital. Again, remember, this is if you have no other insurance. Still in the hospital after those 60 days, days 61 through 90, your costs go up to $408 a day in coinsurance that you're paying in the hospital. Still in the hospital after that, day 91 through 150, your costs go up to $816 a day. And after day 151 plus, you're responsible for the entire bill. So Medicare Part A benefits are per benefit period. And what that means is a benefit period starts when you go into the hospital or go into a skilled nursing facility, and it ends when you've been out of that facility for 60 consecutive days or more. So let me just give you an example. Let's say I have hip surgery. I go into the hospital, I'm in for 5 days. I would pay my $1,632 deductible to the hospital. Then I'm discharged after those 5 days and I go home. I'm home for a week and I go for some follow-up care with my doctor, and unfortunately something happens and I end up back in the hospital. It doesn't matter if it's related to that hip surgery or if it's some brand new condition, but just a week later I'm back in. Because it's only been 7 days and not 60 days or more, I'm in the same benefit period, and my second admission will pick up where my first admission left off. So it'll start on day 6, day 7, day 8, etc., and I won't have to pay the deductible. Yes.
I don't quite understand Medicare A.
Okay.
Everybody signs up for Medicare A.
Yep.
Now, if you're in the hospital and you use Medicare A, where you have to pay $1,632, but you also have private insurance, does the private insurance pick up the $1,632?
So remember on that, I think it was the first or second page of the presentation where we talked about Medicare's here, and then you can go down the path of Medicare Supplement, or you can go down the path of Medicare Advantage. So if you go down the path of Medicare Supplement, Medicare is your primary insurance, and Medicare Supplement would be your second. So Medicare would pay what it's going to pay, and it would leave off this $1,632, and your supplemental plan would pay it.
So my
If you went that way.
The coverage that I have through my spouse, that's your private.
So if you have private insurance through your spouse through work, that's your primary insurance. That's going to pay first. Yes, that would pay first.
That would pay first, and then Medicare would come in?
If there's any left over, yes. Yeah.
does the
So her question is, let's say you get admitted on December 30th and you stay on the 30th, 31st, January 1st, January 2nd. It doesn't, so it goes on the start date that you were admitted. So it doesn't matter if you go into a second calendar year. It'll be based on the start date. Correct. I don't believe that it resets on January 1st.
Okay, that's what I want to know.
Yep.
Makes sense.
Yep. I don't believe that it resets.
It might reset.
So so it does reset every year, January 1st. These amounts could change, these benefits could change, et cetera. But I think what she's saying is if you're already in the hospital and you started a benefit period, I believe it's still going to stay for as long as that applies.
Or do you have to pay an additional?
You wouldn't if you're in the same benefit period. Yeah.
So your primary care insurance covers the first amount before it goes to Medicare A.
If you're working, so when you say your primary insurance, your employer insurance.
Covers that.
Yeah.
And then Medicare A still comes into play, even though
If there's anything left over,
they would cover it. Medicare.
they should. Yep.
They might be involved in.
Right, but there probably isn't much left over after your employer pays. There could be a deductible, there could be something little left over, but yes, yep.
But they would know what to say.
Yeah, when you go for care, if you have your employer plan and Medicare, show them both cards. So they'll know in your records that you have this employer plan and then that you have the Medicare Part A. So they'll bill accordingly. Okay, so we were talking about benefit periods. So back to my hip example, I'm in for 5 days, I pay that $16.32. This time, let's say I'm out for 6 months, then I go back into the hospital. Again, it could be my hip, could be something totally different. Because I've been out for 6 months, that's gonna start a new benefit period. I could even be in the same year, new benefit period because I've been out for longer than 60 days, and I'm gonna have to pay that $16.32 again because I'm starting a new benefit period. So again, this is only if you don't have any other insurance. Generally, people buy other insurance that'll pay this for them. Skilled nursing facility. If you are in that type of facility, the first 20 days are covered in full. What this is talking about is a rehabilitation hospital. So this is not a nursing home. It sounds like it might be a nursing home. It's a rehabilitation hospital. And Medicare only provides this benefit if you are inpatient in the hospital for 3 days and 3 nights. And then let's say you're getting better, but you're not ready to go home, they'll transfer you to this type of facility, a skilled nursing rehabilitation hospital. So Medicare will only provide this benefit if you're in 3 days and 3 nights. Unfortunately, that comes up. So again, if it's 2 days and 2 nights, Medicare's not gonna cover that admission to the skilled nursing facility. So the first 20 days are paid in full, day 21 through 100, it's $204 each day that you're responsible to pay. And then there's no coverage after day 101. Medicare Part B is a little bit easier to understand. So this is your outpatient and doctor services. There's a calendar year deductible of $240 that you're responsible to pay. Once that's satisfied, Medicare will pay 80% of the Medicare allowed amount, and you're paying 20%. And then again, it'll reset January 1st of the next year. So just a reminder, there's no benefits available for prescription drug coverage. No benefits available for services outside of the United States, even if they're urgent or emergent. No benefits for dental, no benefits for routine care. All right, so now we're going to talk about Medicare supplement or Medigap. If you've seen or done any reading, these words are the same. They're used interchangeably, Medigap and Medicare supplement. So again, you're purchasing these from private insurance companies. It's a plan you're adding to your original Medicare plan. It's your secondary insurance. In Massachusetts, Minnesota, and Wisconsin, we have our own standardized plans, and everywhere else in the country does things a little different. So I'm going to show you how they do things in Massachusetts, and I'll also show you how they do things everywhere else. So if you go to the doctor or go to the hospital and you have Medicare and you have a supplemental plan, you're going to give them both cards. So the doctor or hospital is going to bill Medicare first. Any leftover amount's going to come back to the doctor. If you had no other insurance, you would pay that. But if you have a supplemental or Medigap plan, they will bill that plan for you, leaving you again with little to no balance. These plans allow you to use Medicare the way Medicare was intended. And what I mean by that is you're still seeing any Medicare contracted provider anywhere in the United States. So even though you may have bought a Medicare supplement plan through Blue Cross of Massachusetts, you're not using a Blue Cross of Mass network. You're using any Medicare contracted provider. And as a matter of fact, with these plans, these supplemental plans, no matter who the insurance company is, they're all pretty much the same. What's different is the premium. So these are regulated by the Division of Insurance. The next slide, let's go to that next slide. The next slide shows you at minimum what these plans are required to provide benefits for. Those Medicare benefits that we talked about on the left-hand side. And in Massachusetts, there's 3 different types of supplemental plans: Supplement Core, Supplement 1A, and Supplement 1. Anywhere you see a checkbox on your handout, that means that that particular plan provides those benefits. So for example, let's read through this. Medicare Part A, that calendar year deductible, that benefit period deductible, $1,632. If you're enrolled in a Supplement 1A plan or 1 plan, those insurance plans will pay that $1,632 for you. But if you're a Supplement Core member, you would pay that amount. All 3 plans will pay that $408 or $816 daily coinsurance for you. The Supplement 1A and Supplement 1 plan will pay the skilled nursing coinsurance for you for $204. Only the Supplement 1 plan will pick up that Medicare Part B calendar year deductible. So there's 2 differences between the Supplement 1 plan and the Supplement 1A. And one of them is that Supplement 1A does not cover that deductible. You would have to pay the first $240 of your outpatient or doctor services if you're enrolled in this plan. None of these plans provide prescription drug coverage. And actually, these plans add in the Supplement 1A and Supplement 1, add in your Medicare A and B benefits outside of the country. So if you're traveling out of the country and something happens, you're going to need to pay up front, but your private insurance company, your supplemental plan, will reimburse you. So you just need an itemized bill. So these plans do add it in. The core plan, there's no check mark, but you want to check with your insurance company because some of them do add that coverage in. So a couple other things on these plans. The supplement core plans are usually around $120 to about $140 per person per month. So that's supplement core. And remember, you're still paying your Medicare Part B premium, that $174.70. The Supplement 1A plans are usually between $150 and $180, $150 and $180 per person per month. And then the Supplement 1 plans are usually around $200 to $225 per person per month. So remember, I mentioned these plans are regulated by the Division of Insurance. They're pretty much the same for all insurance companies that offer them, except the premium could be different, and plans may add in some little small extras. You see a star by the Supplement 1 or a note. That Supplement 1 plan, so at Blue Cross, we call these MedX. So that just stands for Medicare Extension. That's just how we branded these. So our plans are MedX Core, MedX Sapphire, and MedX Bronze. The Supplement 1 plan is only available to those who were Medicare eligible prior to 1/1/20. So that means you would have had to have been 65 by December 31st, 2019. But don't worry, because the Supplement 1 plans generally actually are less expensive from a monthly premium perspective. And if you do the math, you can end up saving some money with those plans. So, yes. So we're going to get there, but the average premium is about $55 for a Part D plan. Yep. Yes.
Understand this, you have to go to Medicare.
With these plans. So her question is, do you have to go to Medicare doctors? So the answer is, with original Medicare and the Medicare supplemental plans, yes, you need to continue to go to Medicare contracted
Any
doctors.
supplement you buy. So
Correct.
You have to go to,
Yep,
unless you want to pay out of pocket and go to a.
correct. Yep. But it's a really high percentage, 90% plus, that accept Medicare. It's a very high percentage. So that, yeah, that shouldn't be a problem. So her question is, did you say Part D? D. So her question is about prescription drugs, which we haven't gotten to yet, but you can only enroll between October 15th and December 7th. Yeah, or change during that period. These Medigap plans they have continuous open enrollment. And what I mean by that is you don't have to wait till October 15th through December 7th to sign up. So you could sign up, today's the 11th, I could sign up today and it will be effective January 1st. So you don't have to wait for the Medicare supplement plans. For prescriptions. You asked me about prescriptions. For these, nope, so I'm just talking about Medigap plans. For the supplemental plans, you can sign up at any time. It'll be effective the first of the following month.
Sign up anytime at all, and it would be effective that following month.
You got it, the first of the following month. Yep, but you need to be enrolled in Medicare A and B in order to be eligible for these. All right, next.
In the last meeting, you said right away you get penalized
Yep,
or something?
yep, we'll talk about that too. Yep, I just want to wait for prescriptions.
Okay.
Outside of Massachusetts, this is how plans are offered. They're letters. So it's Plan A, Plan B, Plan C, Plan D, etc. Plan F as in Frank and G as in girl are the ones that are most like Supplement 1 and Supplement 1A. The way you read this is anywhere you see a percentage, that's the percentage that plan pays. A couple things that are different though. So in Massachusetts, when you apply for a supplemental plan, we do not ask you questions about your health conditions. In Massachusetts, we don't charge people more based on your age. We can't add waiting periods. We can't decline coverage. In other states, they can do all those things. So they could say, you have a heart condition, we're gonna you're going to have to wait a year before you get any coverage related to your heart. Or we're going to deny you coverage. Or because you're 80 years old versus 65, we're going to charge you more. So other states can do all those things. So you really want to make sure if you should move that you're familiar with the plans in the state that you move to. And you compare and contrast. Okay. Medicare prescription drugs, because I know we've gotten a bunch of questions on page 13. So again, these are also always offered to you by private insurance companies. So Medicare, you can buy these through Medicare, but they're still a private insurance plan. You're going to pay any premium to the insurance company that you've selected. And there's some things that are the same for all Part D plans and some things that are different. So this is going to make more sense on the next page. But one of the things that's the same is these coverage levels. So there's an initial coverage level, a coverage gap, and a catastrophic level. And again, this will make more sense in a moment. But what's different about your prescription plans, first could be the deductible. Some plans may have a deductible amount. Some plans may not have a deductible. So a deductible would be something that you pay before you get prescription drug benefits. The other thing that could be different is the cost share. And the cost share is what you pay, your portion. So it could be in the form of a co-payment a flat dollar amount that you're paying for your prescription, or a coinsurance, a percentage. But I could pay one thing for my drug and somebody else could pay a different amount for the same drug. So the cost share by company is different. The network, where you go to get your prescriptions filled, depends on your plan. So that's different. And most importantly, the formulary. So the formulary is just a big list of covered drugs, and every plan has their own formulary. You can ask before you buy a plan to look at that list, and you want to do that each and every year, because as new drugs come on the market, it's subject to change. So what happens is there's a big list, they divide it into different tiers, and depending on the tier of your particular drug, that'll say how much you're going to pay for your medication. If you have a particular insurance company through work, and then you retire and you use that same insurance company for your individual plan, don't assume that that list is the same. It will not be. They'll be different. So just because you're paying something while you're a member of your work plan doesn't mean it's going to be the same. So it's really super important to check that formulary each and every year. So the next page shows you how this works. So I mentioned the deductible. Plans may have, so just like we talked about before with the supplemental plans, these are governed by the Center for Medicare and Medicaid Services. So at minimum, this is what you're going to see. You could see better than this. There could be an annual deductible of up to $545 in a calendar year. That's what you would be responsible to pay before your benefits would be available. But again, some plans may have $0, may have no deductible, or they may have it for certain tiered medications. Once you've paid that deductible, you move to the initial coverage level. In that initial coverage level, $5,030 that you have, that's an allotment for total drug cost in that calendar year in 2024. So that means both, let's say I'm getting a drug that's called Levoxel, and let's say it's $200 for a 30-day supply, and I'm making all of this up. So I go to the pharmacy, I get my Levoxel, I pay, let's say, a $20 copayment, and my plan pays, did I say 200? So my plan pays 180. That total amount, the 180 that the plan paid and the 20 that I paid, $200, is then deducted from the 5,030. So then I'll have 4,830 left to spend that calendar year. Sorry, I knew it was coming. On medications. Next month, let's say I do the exact same thing, so then I have 4,630. It keeps whittling down.
Until it's zero.
Until it's zero, well, then we'll talk about what happens next. But for some people, you may never spend that amount, and that's okay. And it takes you all the way through the year, and it resets next January 1st. For others, maybe it's 6 months. For some people, it could be the cost of one pill. So at any point in that calendar year, when you reach $5,030, you move to the next level, which is that coverage gap. In that coverage gap, you're going to pay, your cost is going to change. You're going to pay 25% of the cost of generic medications, or 25% of the Medicare negotiated, or the company's negotiated price for that medication if it's brand name. So you're in this coverage gap, you're paying 25% instead of your co-payments or your coinsurance. There's another calculation, there's a lot of math. The other thing that it's doing is it's totaling how much you've paid out of your pocket. So it does not include your premium, but it includes that $545 you might have spent in the deductible, any co-payments or coinsurance, so my $20 that I spent, all of that, my 25%. Once that all reaches $8,000 in a calendar year, you move to that catastrophic coverage level. And you're in that level for the rest of the calendar year, and there's no cost to you. And then everything resets on 1/1/25. And these numbers are able to change or subject to change. You'll get statements that will show you where you are towards these amounts. A couple quick things. So first, it's $229, and I have I'm gonna skip the next page. 1, 2. I probably have about another 15 minutes or so, if that's okay. We had a lot of questions. Is that okay to stay? And if not, feel free to go. So one of the questions we get, these are the plans you see the ads on television for. So one of the questions we get is, how does this even work? How can it be $0 for a premium? So the way these plans work is Medicare pays the private insurance companies a set amount of money for each person that signs up for their plan. And then we use that money to manage your benefits, pay your claims, and add in those extra benefits. So it's now the onus, if you will, is on the private insurance company. What you're asked to do, so when you go to the doctor, you go to the hospital, you're now just showing your Medicare Advantage card. Don't throw away your Medicare card, but just tuck it away, because you're not going to show it anymore. Just going to show your Medicare Advantage plan. You're still paying your Medicare Part B premium, and you need to follow the plan rules. So speaking of plan rules, if we go to the next page, so I mentioned there are HMO and PPO plans that are part of the Medicare Advantage offerings. With the HMO plans, you're designating or choosing a primary care provider. He or she is part of that Medicare HMO provider network. So you're staying in a network of providers. Your primary care provider is giving you referrals to see specialists and other services, and he or she is managing your care. And with these plans, you're paying as you go for care. So you're gonna have co-payments or co-insurance. So you're paying out of your pocket as you go for care. Again, these premiums could be as low as $0. So you may not be paying a premium for this plan, but you're paying as you go. With the PPO plans, they have a little more flexibility. In network, you're seeing any preferred provider organization, any PPO network provider. Out of network, you can see any Medicare contracted provider anywhere in the United States. And again, you're continuing to pay co-payments and co-insurance. Both the HMO plans and the PPO plans include coverage for things that Medicare doesn't cover. Prescription drugs, routine benefits, vision, dental, hearing aids, etc. And a lot of the time, these plans have something called an out-of-pocket maximum. So they have a set amount that would be the most you're going to pay out of your pocket in a calendar year. So it's a protection for you. So her question is, how about outside of the United States? So with the HMO plan, so the answer is, you want to check with your individual insurance company, but in general, with the HMO plans, they'll cover you for urgent or emergency services outside of the country. And same with the PPOs, you'd have to pay upfront and then submit. But again, usually just urgent and emergency. Okay.
You're in California. You live in
So,
Massachusetts, you go to California.
so if you're enrolled in a PPO plan, is that what you're asking? So if you're enrolled in a
You're
PPO,
enrolled in an advantage plan.
an Advantage plan, that's a PPO plan, and you're in California. You live in Massachusetts, but you're traveling and you're in California. So to answer your question, there may be PPO providers in that state that are part of that network. So there may be able to be in network, depends on your insurance plan. If not, you can go to any Medicare contracted provider and it would be out of network. So you'd pay a little bit more out of your pocket, but you'd still get care. But there could in fact be network providers for both the HMO and the PPOs anywhere in the United States. Just depends on the plan. Open enrollment or enrollment options. So there's different times that you can sign up for plans, different times that you can change plans. So we talked about that initial time, that initial eligibility, that 7-month period of time. You sign up for Medicare 3 months before, your birthday month, or the 3 months after. Once you get your Medicare A and B, you can then sign up for any of these plans we've talked about. Annual election period. So every October 15th through December 7th, you can sign up for a plan, but you could also change your plans. So you can change to any of the plans we talked about today. Medicare Advantage enrollment. If you're a Medicare Advantage member, there is an additional enrollment period for you. on January 1st through March 31st, if you're enrolled in an Advantage plan, you can make one more change. And that change would be effective the first of the following month. So if I decided I'm enrolled in a PPO and January 15th, I decide I don't like it, or I find out my doctors aren't part of the network anymore, or whatever it might be, I can call my plan and go back to original Medicare, a Medicare supplement, and a standalone prescription plan.
Would that be effective as of January 1, or is it after April 1?
It would be effective, so you can only make one change during that period of time. It would be effective the first of the following month. So if I made that change in the middle of February, it would be effective March 1st. Yep.
You couldn't go beyond that point, March 31st?
You'd have to call us by March 30, or call the company by March 31st.
Otherwise, you'd have to wait another year.
You'd have to wait till October 15th. Yep. There's also special enrollment periods. Again, you're laid off from work. You've decided to leave work. You've moved into or out of the service area. Whole bunch of different scenarios that either Medicare, Social Security, or the insurance company can tell you if you have that kind of scenario. Sometimes a divorce, sometimes a death, things like that. All different scenarios that would create a special enrollment that would allow you to change your plan. The next page is talking about, I mentioned Medicare Part B premiums are $174.70 for most people, and it's based on something called your modified adjusted gross income. So what happens is, let's say I'm turning 65 in 2024, and I notify Social Security I want to enroll in Medicare. They're going to do a 2-year look back. So they're going to look at my tax return from 2022. So 2 years back. It doesn't matter whether it's myself and my husband or just myself. Doesn't matter how I file. But let's say my husband and I 2 years ago made, I'll say $250,000. So if I look that second column or second row down, that would mean that both of our Medicare Part B premiums would actually be $244.60. Because our income was higher, our Part B premium for that year will be higher. So then in January of 2025, they'll do a 2-year look back again and adjust your premium each year accordingly. You can absolutely file an appeal. So if your circumstances 2 years ago are very different, you were working, maybe you sold your house, whatever it might be, you can file an appeal. And that honestly happens so much. It's right on the homepage of the Social Security page. So, yeah. You can also be charged a additional premium for your Medicare Part D, as in dog. So I'm just realizing I forgot to say something about prescriptions that's important. When you are 65, if you are still working and you have coverage through your employer and you have prescription coverage that's as good as or better than this Part D, you're good. But if you're 65 and you don't have any prescription coverage, Medicare wants you to enroll in a prescription plan. If you choose not to, that's your prerogative, you don't have to. But, and let's say you never enroll in a Medicare Part D plan, then that's okay. But let's say 10 months after you're 65, you enroll in a Medicare Part D plan because you start to get prescriptions, you will be assessed a late enrollment penalty. So what they'll do is they'll look at the national average premium, which I mentioned before is $55. They will take 1% of that, 55 cents, and then look at the number of months that you waited. So let's say I waited 10 months to sign up for a plan. They would do 10 months times the 55 cents. So my late penalty would be $5.50, and it would be something I would be charged each and every month for the rest of my life. So the moral of the story is, even if you're not on any prescriptions, please search around. There are plans that are as low as 50 cents next year per person per month. So there's a lot of options. There's 30 different Part D plans in the state of Massachusetts. Or if you take a Medicare Advantage plan, it includes prescription. So you wouldn't be charged. Are folks familiar with Shine? All right, I'm seeing some yeses, some nos. So Shine counselors work in out of the Tolles-Parsons Center here. They are volunteers. I'm obviously biased because I work for Blue Cross. The Shine counselors are there to give free Medicare counseling, and they are trained by all of the insurance companies, so you can just call and make an appointment at any point during the year. Sometimes they work by phone, sometimes in person, sometimes Zoom. They generally don't work every day. Again, it's a volunteer position, but they can help you navigate the Medicare website, navigate all of the insurance plans, et cetera. So they're there for you. They're great resources. I think I've mentioned Social Security, Shine I mentioned. Outside of Massachusetts, the Shine equivalent is called SHIP, which is just State Health Insurance Assistance Program, but they do the same thing. So it's SHIP outside of Mass. The only thing I don't think I mentioned here, I'll mention the Prescription Advantage Plan. If you are a Massachusetts resident and you need help financially paying for prescriptions, you should look into this Prescription Advantage program. If it's something that you qualify for, they look at income, they don't look at assets at all, so they can help you to afford your medications. So you can, so I think your question is, if I'm still working and I have prescription coverage through work, and I have Medicare Part A, is what you're saying, no Medicare at all, but you're asking if you could then, could you buy a Part D? I don't believe you can have any more than one prescription drug plan at a time. So your work plan would count for that. So if you have work plus Medicare Part A, you can only have one prescription drug plan at a time. So if your work plan includes prescription coverage, then you cannot sign up for a Medicare Part D plan. And you'd also be paying for your work insurance and your Part D. So, okay, I see people looking at their watches really quick.
What does the SHIP stand for?
SHIP stands for State Health Insurance Program, Health Insurance Assistance Program,
And what does SHINE stand for?
serving health information needs of everyone. Great question. Thank you. Yeah, so her question is, if you're enrolled in Medicare Part A or Medicare Part A and B, and it's the end of the year, do you need to, and you want to continue it, you're not making any changes, do you need to do anything? And the answer is no. You don't have to, you don't have to call them, you don't have to go there, you don't have to do anything. All right, so super fast. If you are retiring before age 65, that would be lovely, I know. If you need coverage for someone who is under 65, dependents or a spouse, et cetera, you have a couple options available to you. So first, you could enroll if your spouse or partner is working and you're no longer working, you may be able to enroll in their plan through their work. So if you can, that's a great option. The employer, again, generally pays a little bit towards the premium. You have generous benefits, et cetera. So that's something to look into if it's an option for you. If not, you can look into something called COBRA. So an employee can stay on COBRA plan for up to 18 months, and a dependent or spouse can stay up to 36 months. So again, remember, you're under age 65 in this instance. So you're getting the same exact plan that you had while you were working, but now you're paying all of the premium. And sometimes it may even be 102 or 103%. They may charge you an admin fee. Yes?
Can you get COBRA after 65?
You should not be, you shouldn't be enrolled in COBRA after 65.
If you have kids that are under 20.
They can be on your COBRA plan, yep.
But not if you're over 65.
No, but your kid, right, but your kids can. Correct. Yeah, you'd have to talk to your work and you could have, yep. The last option is something called a direct pay plan. You can call any insurance company and say, I'd like an individual plan, a two-person plan, a family plan, whatever it might be, and they can enroll you. In Massachusetts and in other states, we have something called an exchange. We call it the Health Connector here. So you can also call the Health Connector. And again, they'll offer you a whole bunch of different plan options.
But you pay for it all of them.
You're paying for these. Some of these have no cost. The Health Connector plans, there may be, based on your situation, no cost or subsidized plans. Yep. Not in Massachusetts. Right. Yep, her question is, are there any restrictions? Yeah, there are no restrictions for pre-existing conditions or things like that. In Massachusetts, they cannot decline or deny you coverage because of your health conditions. Yep. Any other questions? Yes.
If you have
Are under 26.
26,
Mm-hmm.
do you know what
These.
they can go for?
So, yeah, so they can, everything we just talked about at the end here. So if you have a spouse who's still working, so you're retiring, but your spouse is still working, they could potentially go on your spouse's plan. Okay, so that's not the case. So they could potentially be covered under COBRA, or you can call the Massachusetts.
How would you be COBRA if you're over 65? Could they be under COBRA?
So not you, but your spouse who's under 65 perhaps, and your children
No,
who,
both of us 65.
okay, but your kids are under.
Yeah, but the kids would be out.
They could be on their own, right. I would talk to your employer to see if the kids are eligible for COBRA, if they're under 26. Because they would have been on your work plan, but now you're 65 and retired. But then the other option is direct pay plans.
But if you employ, you just said that if you're over 65, employer doesn't cover or offer COBRA.
For an over 65-year-old.
Yeah.
So I'm just saying,
Kids are
So-
not 65.
No, but the parents,
correct.
so they're not offered the COBRA.
They'll offer the COBRA if you're under 65 and you're still,
Kids only?
talk to your employer, but they should. Yep. Yep. Any other questions?
Actually, if I could just go back.
Sure. I'm just going to stop the recording if that's okay. So thank you very much.